Hello, everyone. Greetings for the day. I am Priyanjali from All About Skin Wellbeing. I'm sure all of you must be keeping good health. We all know taking good care of your skin is important for more than just your appearance. As the largest organ, your skin becomes the most essential to your overall health. A fungal infection is very common on your skin or nails. Fungal infections or mycosis are diseases caused by fungus, yeast, or mold. Mild fungal skin infection can look like a rash, can be itchy and annoying. So let's connect today with our skin expert, Dr. Rajan TD, live from Andheri, to enlighten us on the topic of fungal infection. Dr. Rajan TD is MD, DVD, DNB, PGD MLS. He has rich experience in this field. Dr. Rajan TD understands this that every patient has a unique skin type and has specific ailments. The best part about him is he takes out personal time for all his patients so that he can understand the scenario, the condition, also the situation, understanding the psychological health of the patient he deals with them. Well, I'm extremely honored to invite him to our screens today. A very warm welcome to you, doctor. With that, let's dive into the first question. What is fungal infection?
Thank you very much for that introduction, Priyanjali. Yeah, so fungal infections are those infections of the skin which is caused by certain microbes which survive in moist conditions. So, whenever parts of our skin remain wet, moist, like between the toes, in the thigh folds, under the armpit, under the breast, in the common active person, or in a bedridden patient who is lying on the bed and he is with a diaper which is wet and moist, so they can get fungal infection anywhere on the buttock area. So these are fungal infections, and fungal infections grow very gradually. So they do not cause any acute problem. And after the patient presents
Mm-hmm.
to the doctor after many months, and then the
Mm-hmm.
infection actually starts showing up. Each infections, and unfortunately, because it takes a lot of time, the patient has allowed the infection to spread to wide areas, and they would have even applied creams and ointments on their own, causing the infection to spread widely.
Right. Now let's
Yeah,
let's
Priyanka.
uh, dive into the basic question, doctor. Identifying the condition becomes a major deal when we are talking about any disease or any condition. So, how do we identify the fungal infection in the initial stage?
If you know that some part of the body has been persistently itching and the skin is getting scaly, peeling, soggy, white, and the itch is more when you are sleeping, when you are resting, and gradually the surrounding skin becomes red, raised. That means you're probably developing a ringworm in the groin, in the thigh, or some other part of the body. There are also other fungal infections which appear only with little discoloration and scaling and peeling of skin. And over a few weeks, you will find that those patches have extended to different areas, maybe with itching, maybe without itching. So, to identify a fungal infection, anything that is not troubling you very harshly, but it is gradually increasing, you be sure it is a fungal infection.
Right. Moving ahead, doctor. How do we take care of this infection when we are in a in a situation where everybody in the home knows that there is somebody suffering from fungal infection in a home environment. So how do we tackle fungal infection in a home situation?
Yeah, good question. And this is a question which is not attended to by most common lay people, which is why the infection tends to spread in the family. If you know that there is a family member who has the infection, and if they are old enough to understand, they themselves should visit a specialist can take treatment. Till about 10 years back, these funguses were not very violent. So a general practitioner's treatment was sufficient, and some cream would be given and the infection would have gone. But now, because the fungus has become more violent and they are becoming more resistant to treatment, you generally need a specialist advice. So I would advise the person who is suffering should take treatment from a specialist for at least 4 to 6 week period, not 1 week and 2 weeks. Do not buy over the counter creams which give immediate relief from itching. Once the person takes treatment, see that the treatment is complete and they adhere to the exact procedure told of even keeping their undergarments washed separately, put in hot water, and then put in the washing machine. Or sometimes we even advise if it is a fungal ringworm of the groin area, the underwear is ironed after the wash so that the heat will kill the germs. And making sure that the person is completely treated, his clothes do not carry the germs, and if they are physically intimate with their partner,
Mhm.
then make sure that the partner is also checked for fungus. If it is there, that person also should be treated. If there are small children in the house, better to make sure their clothes are washed in hot water and boiling water so that the chances of the child being carried by adults and the fungus going to other adults is minimized. If the patient has got diabetes or any other immunological disorder, the immunity is weak, the fungus doesn't leave them soon. So keep sugar, diabetes under control so that the fungus does not relapse. These are few of the care that commonly people can take.
Right. Right. Now, moving ahead, doctor, let's talk about the treatment options which are currently available for fungal infection.
Treatment, if the infection is very early, very localized, and when I say localized, I mean it is only on the surface of the skin. Before I go on to the treatment, let me explain to you the structure of the skin. The structure of the skin is like a notebook. It has a
Mm,
hard cover on top, cardboard, and there are pages inside. So nature has provided a tough covering on the top. Till this covering, the cardboard is dry. The fungus is not able to penetrate this. It is when this cardboard gets soggy. So if you pour water on it and keep the pages below, it will get wet. The same way the fungus then travels through the tough layer into the deeper layer. So as far as treatment is concerned, if the infection is limited to the surface layer, only creams alone are enough. How will you understand that? Many times you cannot understand that. But if your doctor has in the past given you an antifungal cream, just apply the cream what you have been given. There are creams containing clotrimazole, ketoconazole, emerolfin, fluconazole, various creams. Now it is not easy to remember the names. So if that cream alone can penetrate the surface layer, it will cure the disease. But if the infection has gone to the deeper layer, which is the common situation in most skin clinics because the patient comes late. If the person is working in wet conditions, the housemaid, kamwali, bai, they are always working in water, they are washing utensils, their clothes are wet because they are always with water. The one who is working as a plumber, manual laborer, a painter, their clothes are soggy. So they usually have extensive fungal infection. So they need external creams and oral tablets. Which are the oral tablets? There are tablets containing itraconazole, fluconazole, terbinafine, griseofulvin. These are not easy names for common man to remember. So go to a dermatologist. They will give you antifungal tablets. They will give you antifungal creams. And in addition, each doesn't go with these tablets. So tablets to reduce the itch is also given. Take the course properly without interruption. Now the funny thing, within a week of the treatment, the itch disappears, The skin looks clearer except for the mark. The red ring may
Mm-hmm.
flatten. So the patient is tempted to stop the medicine. This is a mistake nobody should commit. They will again have a relapse. So complete the treatment for 3 to 6 weeks as advised, and then only you can stop treatment. And even after treatment is over, most doctors will tell the patient to keep that cream handy, not to forget that name. Rather than putting another wrong cream after 6 months, it is better to have one old cream of yours which has given you result, which the doctor has said is safe to be kept for long. So
Right.
that is the method of
Right.
treating fungal infection.
Right. Now, doctor, when we are talking about fungal infection, the major issue is recurrence of the fungal infection. People are bothered due to the recurrence, and uh, a lot of people has somehow losing hope that it's not going to get cured. It's going to be the same for the rest of the life. We have to keep on just taking the medicines, and the maintenance just carries on for the rest of the life. So, tell us, how do they deal with this recurrence issue?
As I have been reiterating all along, recurrence occurs primarily because of incomplete treatment. For the layperson, 4 to 6 weeks sounds very long. It is just a mild itch. क्यों देना है इतना दवा, इतना क्यों खाना है, लिवर खराब हो जाएगा, वो खराब हो जाएगा. So there are a lot of these comments which people make. What people do not understand is if you do not complete the first course, your doctor will be forced to repeat the course periodically again and again. So the thought that the fungal infection doesn't get cured is wrong, but the thought that kind of a discussion is happening because people have taken incomplete treatment. So with a 6 to 8 week or 12-week treatment, most patients without any underlying immunological weakness, most patients with good hygiene who keep their skin dry without being too much moist will get completely cured. So fungal infections are 100% curable provided provided the patient has completed the treatment and is following all the instructions given. The doctor also advises about clothes. Then denim wear, which most youngsters use 7 days a week, is one of the causes for repeated fungal infection because the denim thread is not suitable for 80% of India's climate, except for the extreme north, northeast, which have good winter. Rest of the country, we are living in hot and humid climate. And the denim
Right.
thread is so thick that fungus lives in that. So I tell my patients, wear jeans only on Monday, Wednesday, and Friday. You will wonder why. Left to me, I would tell them not to wear jeans, but then that is fashion. So one day if you are wearing jeans, next day if you are wearing some thinner material, whether it is a man or a woman,
Mm-hmm.
there is more of air entry allowing the skin to dry. So this is one of the methods. Thirdly, denim jeans do not get washed every day. Most men will hang it on the hook at the end of the day and again unhook it and wear it. So if they change this practice, wash their clothes daily and wear loose clothes all the time, mostly cotton, they will not have repeated
Mm-hmm.
fungal infection. Also,
Right.
not wearing the innerwear, the brassiere and the
Mm.
panty or the undergarments at night is a good method of allowing skin to be breathing, to get more air.
Right.
So the fungus
Right.
cannot lodge within the folds. So that is another
Right.
method. And taking bath twice a day if your work involves a lot
Mm-hmm.
of hectic activity and
Mm-hmm.
drying your body well. Most youngsters
Right.
pour water on their body and then wear clothes. So their clothes continue to remain moist, allowing more fungus to enter the body. So if all these
Right.
precautions are taken, if there is no underlying neglect, if there is no underlying low
Mm-hmm.
immunity, fungal infections are completely curable.
Right. So we can say that just the treatment would not do the work. It's a maintenance therapy which you need to maintain throughout your life. Right. So, yes, people dealing with fungal infection, I believe this piece of information was really, really helpful for you because it's a lifestyle change. Ultimately, you have to change the way you're living your life, and you have to be consistent regarding it. So, yeah, uh, I hope, yes, doctor.
I had another point to make which I missed.
Yes, sir.
We are all eating processed foods. We are
Mm-hmm.
eating lot of sweets, high calorie, high calorie food. We are celebrating birthdays, parties, cutting
Right.
cakes, pastries, in addition to our normal food. We are going more to eat, more out to eat after eating at home. So all of us are stuffing ourselves more. So obesity, weight
Right.
gain is an important
Mm,
reason for fungal infection increasing. If you gain
I agree.
5 kilos of weight, your thigh diameter,
Mm-hmm.
your arm diameter increases by few centimeters. So if your thigh diameter increases by 1 centimeter, the gap between the thighs reduces. So the air entry
Right.
reduces. So these fungi are able to multiply. So obesity, weight
Mm,
gain is another major cause of repeated fungal infection. Yeah.
right. Um, well, well, that was some serious information for all of you. I believe it was helpful to you. Moving ahead, doctor, tell us what is the most serious kind of fungal infection when we are talking about fungal infection? What can be the worst case scenario?
Uh, when we say serious in skin, consultation, there is no
Mm-hmm.
life-threatening serious fungal infection. Serious can be
Right.
if the man comes with a fungal infection, doesn't take proper treatment, and 2 months later his wife or partner comes with fungal infection. For me, that is serious because from
Mm-hmm.
one person the infection is now gone to two people. So it's a community spread, which should not happen. Or if the mother has got fungal
Right.
infection under the breast and the mother has not taken treatment.
Right. I believe there is some network glitch. We'll try and fix it. In the meanwhile, people who are already with us and who are still joining us, we'll request you all to come up with your questions because by the end of today's live, we answer all your questions.
Yeah. So I was coming to that. So when you said serious complication, so if the husband has and the wife also gets it, I think it is serious. If the mother, breastfeeding mother, has got fungal infection under the breast and she doesn't care or she doesn't know,
Mm,
and the child comes with a fungal infection, I have seen young infants coming with an infection on the cheek, and imagine having to give a
mm,
lot of cream to that child, to that infant. So that is also serious. And the other serious is having fungal infection in the skin in one part. They have scratched it, and more bacteria have gotten, and they have got mixed bacterial and fungal infection. So that is another serious
right.
part. And the deeper the infection, more bacteria in, the scars are more or less going to be there forever.
Mm-hmm,
So that is the
mm,
complication. And lastly, people who self medicate with creams, not knowing what is the proper treatment. They have
right.
spread the fungus to all over the body. In fact, most men will come or women will come with one semicircle on the face. And I will guess that the remaining half of the semicircle is on the shoulder. Or a lady wearing a sari and blouse. Under the blouse, I will see one semicircle. I know that there are many remaining circles on their body. So extensive fungal infection, and the itch of fungal infection is so terrible. People have told us that they won't feel like committing suicide, and this is not an exaggeration. It is very irritating,
Mm-hmm,
very troublesome. So that these are all the complications, and it interferes with their work. The woman can't cook, the man can't concentrate in office, the factory worker is not able to handle the machine properly because his one hand is on his
mm-hmm,
leg or neck or some other part. So this is the complication. So medical complication is bacterial infection and spread to other areas, and social complication is spreading it to the large numbers of the community.
Right. Well, I believe these are the things which we normally tend to miss on. These are very basic, and we tend to miss out on the basic things. People, I think we should all be cautious about it. Now, doctor, because you are mentioning about the baths, uh, we know that nowadays we see men, women working equally in every single sector, and also in such scenario they are bound to use the public toilets, say. So how do we prevent ourselves from the fungus which is spread from the public toilets?
Your question is very valid and very important. In fact, this question has a lot to do with how our society functions. No, we are very
Mm-hmm.
unhygienic as a community. We do not
Right, I
care
agree.
to leave to clean the toilet when we leave. Once the person uses the
Mm-hmm.
toilet, when that person leaves,
Right.
it should be in a usable condition for the next person. So when we talk about public toilet, the things are a lot better
Mm-hmm.
than before, because I think now the paid public toilets made by government are also managed by people who maintain hygiene. But I do not see a easy solution to this. We should choose those toilets which are clean, and maybe spray a little sanitizer on the top before you sit on the toilet. And once you get up, if you can clean yourself with a wet tissue, I think those are also good ideas. uh, um, Protecting yourself from getting infection is more important, and when you leave the toilet, at least you make sure that you do not make it soiled so that the next person suffers.
Right. Now, also, doctor, the groin area, whenever we are suffering fungal infection from the groin, in the groin area, we also have seen people suffering from fungal infection. At the same time they are also suffering from UTI. Tell us also, I know it's a little off topic, but tell us, can both of these two be related somehow?
In men, the chances of fungal infection leading to UTI is less likely because of the way the genitals are structured. But in
Right.
women, because the urinary opening is short, and
Mm-hmm.
if a woman who has got a fungal infection in the vaginal area keeps scratching, keeps rubbing,
Right.
there is discharge, then it is inadvertently some amount of the infection goes to the urinary tract also. So the same fungus
Right.
does not cause UTI, but because of the handling, bad handling by the hand, which is already contaminated, women tend to get UTI because they have rubbed that genital part too often. So that is a different infection altogether. And for a woman with
Right.
UTI, usually a gynecologist assessment will be required. And if there is a lot of
Right.
burning in urine, frequency of
Mm-hmm.
urination, or they have to get up
Right.
in the night many number of times, or they feel feverish,
Right.
I think a gynec consultation is important. For men,
Right.
usually fungal infection do not translate into UTI.
Right. Now, doctor, also tell us, when we are talking about fungal infections, there is also another kind of fungal infection which is very stubborn. Uh, I think you have initially talked about it, but in the household we see women, who are mostly in contact with water, the nail fungal infection, which is stubborn, and it usually takes longer period of time to get uh, healed or cured, whatever we can say that. But a lot of us think that it cannot be cured because because of the reason, of course, the obvious reason that it takes a lot of time. But tell us, doctor, can it get cured if somebody goes through the treatment properly?
About nail fungal infection is the question.
Yes.
Yeah. So, nail fungal infection happens again in people who are working in wet conditions. So, housemaids, housewives who are constantly in water, women who go to the manicurist and pedicurist. Sometimes the attendants at the salon, at the parlor, they fiddle with the
Right.
cuticle. The cuticle gets separated and the gap happens. That is another situation. Third is people who have diabetes or poor nutrition. They have very weak cuticle. They also get nail fungal infections. Now, mind you, the nail is about 2 centimeters long. This is called nail plate actually. So if the person has got an infection around on the entire nail, the treatment has to be
Mm-hmm.
done till the entire nail is expelled. For a fingernail, it takes 3 months for a fingernail to grow out completely. The toenail, it grows much slowly. So it takes about 5 to 6 months for the toenail to come grow out. If you think how often do you cut your toenail? Once in 1.5 months,
Mm-hmm.
you cut a little bit and then again you don't cut it.
Right.
Fingernails every 2 weeks or something you will be cutting. So the treatment for the fungal infection of the nails will be 100% complete if the complete nail grows out. So every good
Right.
doctor will tell you that the nail at the bottom, that is close to the junction of the skin and the nail, that has to be closed.
Mm-hmm.
So the cuticle has to be intact, and whatever cream is being given by the doctor for the nail infection should be applied neatly right up to the corner. So after about a month
Right.
of treatment, you will see that the nail has grown forward. So there is a slight band of healthy nail coming out. This indicates that your last 30
Mm.
days treatment has worked. Treatment cannot be stopped because you have 80% of the nail will still be bad. So unless you completely treat the whole nail, so you allow that little band to increase and the unhealthy nail to decrease. So if the whole treatment is done for 3 months for the fingernail and about 5 to 6 months for the toenail, the nail will be completely cured forever. If out of 10 nails, three are cured and five are still not cured, or other way around, the bad nail can again infect the good nails. So once you get a fungal nail infection, be regular with the doctor, regular with the cream application, and wait for that entire bad nail to grow forward and fall off or get cut off. So please understand that whole nail has to grow forward,
Right.
forward. So after 2 months or 3 months also, there will be a 10% nail which is bad. Don't stop the treatment there. If that is completely treated, it is 100% curable.
Right.
And I know there are many people who have come to me casually and said the patient will come for their son or daughter, and the old man will say, I got
Mhm.
this nail infection, but I don't think there is any cure for this. So I tell them that if you take treatment for about 3 months, if it is fingernail, or 6 months, it will 100% get cured. If you give that confidence to the patient will
Right.
follow the treatment,
At
and 99% of the patient will get cured.
at any point in their life, we are saying we're talking about that, right? And any point in their life, if they have suffered for the infection for the past 3 years, 5 years, or say 7 years, 10 years.
Yeah. Yes.
Right. Well, that brings a sign of relief for all our viewers. Doctor, also tell us, how do parents deal with their children when they are suffering from fungal infection? Because it gets very hard for us to always monitor them wherever they are going in the school situation, say. So, how do parents deal with this? Also, we see children suffering from fungal infection in the head mostly. So, yeah, how do we deal with such situation?
There is no easy answer to this. You have to convince the child the need for proper shampooing of the scalp, proper drying of the hair,
Right.
and Proper nutrition.
Right.
Children need proper nutrition. If they will eat
Mm,
only chapati and potato and not eat vegetables, and they do not have a proper balanced diet, certain nutrients are in short supply. So then they tend to suffer. So I don't think there is an easy answer. So making the child
mm-hmm.
eating well, building up their immunity will prevent fungal infections. And also, when the infection is noticed, making sure that that complete treatment is done. There are only two ways: completing the treatment and giving good health and nutrition.
Right. Moving ahead, doctor, I can see a few questions coming up from the viewers. Let's take the first question. Comes from Riya Sathi, who asks, "Do not washing hair for longer time can washing hair for longer time cause scalp fungus?"
Washing hair with proper drying and proper hair care cannot cause fungal infection. So there are women
Right.
also with long hair who wash every
Mm-hmm.
day in villages, and they are able to dry up their hair by keeping it open for sufficient time. If they can do that, then you cannot get fungal infection. But at the same time, if
Right.
the woman is in a hurry and working and has got long hair and ties up and goes, then they are prone to fungal infection.
Right. The next question, doctor, comes from Firoz Khan. Asks, "Does fungal infection cause? Can fungal infection be caused from the gym environment?"
Of course, yes. When people go to the gym, they wear synthetic clothes,
Mm,
and the synthetic material does not allow the skin to dry.
right.
I told you the skin has got the top layer, which is a tough layer. If that remains wet for a long time, fungus will come in. All the same, if you wear hosiery material, bunion, panty, trousers, whatever, the sweat gets absorbed. Whereas if you wear synthetic, the sweat is there on the skin, the cloth just takes it up but doesn't dry up. So in the gym, that is one of the causes of fungal infection. Then equipment like dumbbells and all are handled by numerous people. Obviously, some
Mm-hmm.
fungus will get transferred. So after you come from the gym, that is why do not wait for 1 hour to take bath. Try and get
Right.
into a fresh set of clothes after bath as the earliest. It is very important.
Right. Right. Doctor, we have already talked about it that reusing clothes fungus does not spread from reusing clothes, right? Or wearing the clothes repeatedly for 2 3 days sick.
It depends which place you are coming from. If
Right.
you are in a place which is very cold and dry and you don't sweat,
Mm-hmm.
then your body will not have much fungus, clothes will not have
Right.
much fungus. But if you are
Right.
living in a place like a humid place like Bombay, where I practice,
Mm-hmm.
there is no way you can repeat your clothes without washing,
I
because
agree.
your at least the inner clothes have to be washed every day. In fact, to be changed twice if possible. But the outer clothes, if they are, soaked and wet with sweat, then you cannot
Mm-hmm.
rewear it without washing. So,
Right.
if you are working in an air-conditioned environment, also there is always some
Mm-hmm.
sweating in the skin, and your clothes generally are contaminated. So, doctors
Right.
with today's situation of fungal infection will not encourage you to not wash your clothes and wear again.
Right. The next question comes from Desu Desai. Asks, "I have white patches on my chest after the rain. Could it be fungal infection?"
Yeah, light colored white patches is a superficial fungal infection called tinea
Mm-hmm.
versicolor. So
Right.
it could be a fungal infection, what you are saying. You'll have to go to a dermatologist
Right.
and get it diagnosed and treated.
Right. Moving ahead, the next question comes from Deepak Saxena. Asks, "Why does my wife's fungal rash keep coming back even after using cream?"
White fungal, again tinea versicolor. Now, scientists have discovered that there are certain weak immune systems. So I may be
Mm,
a person who has good, tough immune system. I don't get TB and major illnesses, but
right.
I get repeated tinea versicolor. So there is a weakened immunity to tackle certain germs that has been explained in medical science. So that is why
Right.
certain people are more prone to certain fungal infections. And this is true not only
Right.
of fungal infection. You will have a very healthy executive attending office, and you will come to know that that person has got tuberculosis or some other infection which is there in the air, and that person will be otherwise healthy, but one infection your immune system is not able to tackle. So that is why some people are
Mm,
repeatedly prone to tinea versicolor.
right.
It's a genetic
Moving ahead, the next.
predisposition.
Yes. Yes, sir. Right. The next question comes from Tanishka Rajoria. Asks, do repeated fungal infection in the genital area mean my immunity is low?
Not necessarily.
Mm,
Most of the time, it is not to do with it. If you are a young, healthy person, it means you are probably hygiene is poor, or you are wearing the wrong kind of clothes. When I say hygiene is poor, I mean you may be taking bath only once. You should take twice. You may not be drying the body before wearing clothes. So you have to do that, and or it is that your type of clothes you choose should match with the type of work you do. If you're working in a factory environment and you're wearing tough, sweaty clothes, then it will keep getting infected. So it's not nothing to do with low immunity.
right. The next and the last question today, doctor, comes from Sumit Sen. Asks, can I treat fungal infections using neem or coconut oil instead of medicines?
Uh, yeah, this is a very common question we face. Now, if the
Right.
infection has penetrated the deeper layer, then no home remedy will work. You know,
Mm,
in the early days, about 25 years ago, a little bit of itchy fungal infection was treated with a lot of
mm,
home remedies. In today's day and
right.
age, these things don't work. So let's not waste time and allow the fungus to spread. And don't be scared of medicines if they are given by the right doctor. You
Mm,
visit the right doctor and take the medicines as he or she says. Don't get scared of medicine.
right. Right. Well, I think it was a wonderful discussion today, Doctor. We got to learn a lot of new things from you today, and it was a very helpful session for our viewers today. Before we take a leave, any take home message for our viewers who has watched us so far?
You, for me, take home
Any
message.
any any take home message you would like to give it to our
Yeah,
viewers
so
who has watched us so
I've
far?
already given the message. I will repeat one more time. If you
Right.
feel it's a fungal infection, something is itching often, then please make sure you're going to a dermatologist or a skin specialist
Mm,
and not buying a cream from across the counter. One very important
right.
take home message is there are
Mm,
creams called Quadriderm, Dermi 5, Candid Plus, A this plus, that plus, 4 Derma, where there are a lot of combinations, including steroids, and
mm,
those are given by chemists because it costs only 30 rupees and the itch goes away. So many people, by repeatedly using these kind of creams, get a lot of relief, but they spread the infection deeper. And you will not believe, I see a lot of young people with stretch marks in their thigh area, on their chest area, on their shoulder area, because these creams, when they are used beyond a period of 8 to 10 days, cause thinning of the skin. So please do not go to a chemist and pick up a cream. You can do it for the next 3 days if you're traveling by train. But if you're going to be
right.
in your house and the itch continues beyond 3 days, please don't use these creams. Visit a doctor. Take home messages. Complete the treatment. Fungus is curable. It may take 2 months, but complete the treatment.
Well, that was the expert advice for today, and that was Dr. Rajan TD for us. Thank you so much, Doctor, for your valuable time. It has been quite an informative session for our viewers today, and we look forward to many more such sessions in coming times. Also, thank you, viewers, for your excellent participation. For more information and updates on skin health and care, stay connected on our Facebook page, All About Skin Wellbeing. We are also available on YouTube, Twitter, and Instagram. Thank you. You all stay safe and stay healthy.
Thank you, Pranjali. You have been a wonderful anchor.